Gauteng is rapidly catching up to the Western Cape in terms of COVID-19 infections. The province is set to become the next epicentre, but what lessons can Gauteng learn from the Western Cape's response to the pandemic? Dr Glenda Gray was one of the hosts of a webinar yesterday discussing the province's response to COVID-19. She joins us now. Very good morning to you, Glenda Gray. Firstly, it feels like we're sitting here in Gauteng waiting for a tsunami to hit us. What can we expect?
So, good morning to you. Yesterday, we looked at the way the Western Cape doctors, both in the public and the private sector, managed the surge of the epidemic. We learned that you need a whole hospital approach, that you have to engage all the doctors and all the nurses. You have to make sure that there are teams that are working well together and who are available to be with the team all the time. We also learned that you need good communication between referral hospitals and the major hospitals. We also heard about the need to make sure that we address the mental health issues of healthcare workers. They are facing huge amounts of death and morbidity, and we need to make sure that they don't get burnt out and that they're protected in terms of their health, their mental health.
And what about the synergy between the public and private sector? Is that going to happen, materialize to make it more effective, the fight against COVID?
So the relationship between the public and private sector has to be strengthened, and we need very good and definite SLAs between the public and private sector in the provinces, and we need a good working relationship. The good news is that all the doctors and nurses have been trained both in the public and private sector. The doctors were at the same universities and in the same medical schools and the same hospitals before they went into practice. So there is a good relationship between the two. And so what has to happen is that there has to be a seamless transition between the public and private sector when the need arises, and that the relationship is synergistic so that patients don't have to wait and are taken care of irrespective of whether they're public or private sector patients.
Okay. We hear a few disturbing stories about what's happening in hospitals in Gauteng, and I should imagine other parts of the country. It's very hard to really know what's going on because we can't get in, family members can't get in. Are you happy with what you're hearing about how patients there in these hospitals here are being handled?
Well, I think it's quite traumatic because obviously the loved ones can't get in and can't see their loved ones because of their illnesses. And so what I saw in the webinar yesterday was innovation, where staff would work on to do conference calls, WhatsApp calls with patients so that they could see their loved ones. We also were described how critically ill people were able to talk to their loved ones through the internet, through a little tablet that the staff had managed to get together. So I think it is very difficult. This is a horrible situation to be in when you are sick and you don't know what, or your loved one is sick and you don't know how to access them. You don't know what's going to happen. And so we also have to try and find ways, electronic ways of making sure, digital platform ways to make sure that loved ones can communicate with people inside the hospital.
Glenda, we were told this morning that Gauteng will experience a relatively low mortality rate compared to possibly the Western Cape. What do you make of that? Is that true?
I think it's very difficult to say right now. The case fatality rate has been around 2% in South Africa, which is relatively low. And you have to see what happens when more and more patients get to hospitals, when critical beds are scarce and when there are oxygen issues and shortages. And so it's very hard to predict exactly how the mortality will change. The busier the hospitals get, the more people that need oxygen, and the more care you need, the more nurses and doctors you need, and the more chances are that morbidity and mortality will increase. And so I think one has to watch what happens and make sure that there are adequate staff, adequate teams of nurses and doctors, and adequate provision of services like oxygen to the hospitals.
And what have you learned from hospital stay here in South Africa and globally that will make the situation here a little easier when it comes to treatment and what we have access to?
Well, I think when we spoke on the webinar, we heard about the need for infrastructure, equipment, make sure that there's a sufficient supply of PPE, oxygen and making sure that you have enough nurses and doctors on board. We heard about absenteeism, which is a problem because obviously people are scared. We heard that a lot of healthcare workers catch COVID in non-COVID areas like tea rooms in the hospitals. And we also heard that a lot of healthcare workers were worried about not having enough PPE for themselves when they were looking after patients. What we did see was a huge commitment by everyone, nurses and doctors, to ensure that they work together to support people who were infected in the hospitals and how to manage them properly. And so what we did see was a huge commitment, a lot of bravery and courage, and a lot of teamwork that was very important to engage. And teamwork is important because obviously you need a team to be able to work together, to be able to make sure that you can manage and care for patients with COVID in the optimal way.
And what was said about schools and how it's playing out and the dramatic infections there?
We didn't speak about schools per se. We spoke mostly about the treatment of patients in hospitals. We do know that the admissions are increased the older you get, and we do know that COVID outcomes are affected by comorbidities like HIV, TB, diabetes, obesity, and hypertension. And we also know the older you get, the more likely you are to have worse outcomes. And we do know as well that children have better outcomes and are less likely to be severely affected by COVID-19.
Thank you, Glenda Gray.